Suswagatam, Suswagatam, Suswagatam. A very warm welcome to all my dear friends. आज आपण येथे प्रिलिमिनरी डाटा ते रेपर्टरी सिलेक्शन अशा या केस टेकिंगच्या सुंदर प्रवासासाठी जमलेलो आहोत. केस टेकिंग हा प्रवास खरंच सुंदर असतो का की खडतर असतो? अशा अनेक प्रकारच्या अशा प्रश्नांनी मन व्याडलेलं असतं. पण डॉक्टर रसाळ सरांच्या मार्गदर्शनाने हा प्रवास अगदी सोपा झाला. केस टेकिंगला सामोरं जाताना आणि पेशंटला सामोरं जाताना आपल्या मनात अनेक प्रकारचे प्रश्न निर्माण होतात. आपण केस टेकिंग कशी घ्यावी, आपल्याला केस टेकिंग घेता येईल का, त्याचप्रमाणे पेशंटने सांगितलेल्या कंप्लेंट कशा प्रकारे नोट डाऊन कराव्या, पॅथॉलॉजीला किती इम्पॉर्टंट द्यावं, मेंटल आणि फिजिकल सिम्पटम कसे नोट डाऊन करावे, तसेच मॉडॅलिटीज कशा लिहाव्यात आणि केस टेकिंग बद्दलचा कॉन्फिडन्स आपल्यामध्ये कसा वाढवावा, अशा प्रकारच्या प्रश्नांनी मन गुंतलेलं असतं. पण हा मनातील गुंता सोडविण्याचं काम आज येथे सर करणार आहेत. सरांच्या मार्गदर्शनाने, सरांच्या सखोल ज्ञानाच्या मार्गदर्शनाने हा गुंता अगदी सहजरित्या सर सोडवतीलच. मागच्या सेमिनारमध्ये रेपर्टायझेशन सिम्प्लिफाईड वे हा टॉपिक होता. रेपर्टायझेशन सरांनी अगदी सोपं करून सांगितलं आणि सखोलरित्या समजून देखील सांगितलं. आज देखील सिम्प्लिफाईड वेने सर केस टेकिंगचे डूज अँड डोंट्स सर आपल्याला सांगणार आहेत. फ्युचरमध्ये स्वतःकडे एक होमिओपॅथ म्हणून बघण्याच्या दृष्टीने केस टेकिंग आणि त्यातील कॉन्फिडन्स हे खूप महत्त्वाचे असते. आज हा सेमिनार आपल्यामध्ये एक नवीन सुरुवात करेल, तसेच एक नवीन अनुभव देईल. तरी या केस टेकिंगच्या सुंदर प्रवासासाठी आपण सर्व तयार आहोत ना? मी डॉक्टर सरांना विनंती करते की डॉक्टर हानेमन सरांच्या प्रतिमेला वंदन करून आणि त्यांचे पूजन करून सेमिनारला सुरुवात करावी. धन्यवाद.
Hello, are you getting my voice?
Yes.
A very warm welcome to all of you on this specific day as the Divine School of Homoeopathy. Before starting our seminar, it's always better to pray our God. All three goddesses are there. Dhanvantari is there, Hippocrates is there, Dr. Samuel Hahnemann is there, and most important goddess, the Saraswati, is behind them. She is also there, as well as Swami Vivekananda is there. I will ask few of you have to be a volunteer, one from Ithapia College, one from MHS College, one student from second year, one student from third or fourth year. Do come over here. Please enlighten the lamp and start the seminar. First, मागच्या वेळी जे आले होते ते नवीन आलेल्यांपैकी कोणी नव्हते. पटकन you have to start. Last time कोण होतं? Do come, please. एकांमध्ये volunteer पटकन चालू आणि फोटो. जरा टाळ्या वाजवा. Thank you. So, dear friends, very warm welcome on the behalf of Divine School of Homoeopathy, and we are gathered together, and there are many new faces which I am saying. It's a very good thing that something has happened, change has happened over there. So, warm welcome, and we'll start with our session. And already we have prayed Dr. Samuel Hahnemann, who has developed a specific path for us how to go ahead in the field of homeopathy. Since 1789, he has started experimenting, developed, discovered the science of homeopathy, the law of similars, and explained it to the world in 1796. And ultimately, when he died at the age of 78 in 1843, till last breath he was experimenting. So this is very important thing. The path is of experimentation, going ahead with experimentation, and because of which it was possible that we have got many more new editions of organ of medicines. प्लीज पुढे येऊन बसा. पाठीमागं मुलं आले तर त्यांना बसता येईल. माझ्या खूप खुर्च्या रिकाम्या. प्लीज लास्ट पुढे येऊन बसा. थोडं पुढे सर. पुढे made a very good path for us of doing the experimentation. Please view. And we have to go ahead with the experimentation. He has changed the editions of organelles right from 1810 to 1833, and last edition, which was available for publication in the 1842, ultimately published by his second wife in 1921. That is the 6th edition with which we are working with. We have not gone beyond that. Actually, it is our duty to go beyond that, but we have not gone beyond that, and that's the footsteps. This is the path with which we have to go ahead and experiment, and we have to come to certain conclusions. So today's topic is practical case taking. Last time we have discussed repertory and a simple way of repertorization, methods of repertorization, how to go ahead, how to understand repertory, everything which we have discussed at that time. Today we are going to learn a simple way of applying the knowledge of case taking which Hahnemann have explained over there in the practical manner. I will share many cases, I will share many thoughts, I will share it with the Borix Materia Medica, I will share it with the Kent's repertory, everything, so that it will will become more palatable and easy, and then you will never have a burden of case taking. Because it happens, how I will going to take my first case. This is always a burden with anyone who starts taking the first case. Unless and until you take the first case, that burden never vanishes. But once you take it, then you find it's too simple. But the question arises, what are the things which are very essential in the case taking, which will guide you exactly towards the remedy? What is the purpose of case taking? Why do you do a case taking in homeopathy? Whether it is acute case, whether it is chronic case, what is the purpose? Individualization. It is not collection of data, it is the individualization. Yes. And what you have to individualize? You have to individualize the person a remedy. You have to individualize the person's remedy. So to come to a very specific remedy, case taking is necessary. Right, there are many queries arises in our mind. Sir, how much time for acute case we should give? How much time does it require for chronic case? There are many queries. Is there any fixed answer to this question? Sometimes case can be solved with the first sentence itself. You get the remedy with first sentence because you got something very important. And that is what is called as a case study. So case training doesn't have a specific limit, whether it takes 1 minute or whether it takes 1 hour. One of the friend who has taken a case for 10 hours. One case 10 hours. I don't know, but he told me that I have started in 10 o'clock in the morning. I have finished it at 9:30 evening. In between, we have taken 1.5 hours lunch. This is what he told. But this varies from individual to individual. But if you want to go with this practical case taking, what is important is perceiving. 2 words, perceiving and the communications. What is perceiving? What is to perceive? Perceive means to understand, sometimes verbally, sometimes non-verbally. Just look towards you apply this every time in your lifetime. Every time you apply this. You enter your class, you see your friend's face and you comment. What is wrong with you? You have not uttered a single word. You have not talked anything. Just looking at the face, you say, what is wrong with you? This is what is a case taking. When a patient enters, you look towards the patient and see what's wrong with you. This is not the question with which you every time start your cases, but this is the thing with which you can understand the patient. Perceiving happens like that. It is a quality which is empowered with each and every human. It is there with you. Only thing is that you have to specifically apply this with the patient. It is there, but you have to apply it with the patient. At the same time, second important quality one should have the communication skills. Whether the patient is of a small child, whether the patient is of your age, whether the patient is elder than you, or whether the patient is absolutely old. Whatever it may be, you should have a communication skill, ability with which you can communicate very easily with them, whoever it may be. These are 2 important parameters on the basis of which your case taking depends. And that's why it's too important to develop these 2 important qualities in you. In fact, you have to learn to develop them. So question arises when a case taking starts. So what is your answer? When it starts? When patient enters in your room. Okay, any other answer? Sometimes calls. Very good. Anything? Yes, we have to discuss. It's a logic. Always you have to develop your logic process, thinking process. So what you have to look for? How a patient approaches towards you. Case taking starts at that level. How the patient has approached towards you. With prior appointment or without prior appointment. He comes, enters, doctor, may I come in? He is already in and still he is asking, doctor, may I come in? Something has got, something has you have received. You got something. What is that? When patient enters like this, he enters, doctor, may I come in? He enters. What is this? Okay, anxiety. Anything else? What you will say it in your language? Marathi तुम्ही काय म्हणणार? हिंदीत काय म्हणणार? एसटी हरे. बरं, अजून anything else?
Attitude.
No attitude. मराठीत एक शब्द आहे. What is the word in Marathi? धसमुसळ्या. Now you have to convert it into English. Abrupt. Rubric on Kent's repertory, first page. You get the rubric. Abrupt. Open your repertory. It is there. Is it there? Abrupt. See, case taking is not like that. Are you abrupt? You are not going to ask. It is the nature we have to catch. You have to perceive. You have to understand. You have to confirm. You have to see. This nature you have to watch and catch. You got the rubric. Out of 3,000 remedies, you get a small group of remedies under the abrupt rubric, and you are damn sure because you have experienced the abruptness of that person. But you should not take it on immediately that patient is abrupt. It might be because of some reason. You would have taken your appointment. You have given him 8 o'clock appointment, and somehow his car is filled, and he came and you have given him appointment at 8 o'clock, and he reached over there at 8:15, and that's why he might be hurried. There might be any reason. You have to think that reason also behind that. But at least what you have pursued, that patient might be an abrupt person. That one thought has developed. Your logic has started working. That patient might be abrupt. Second thought might be if he is coming at 8:15 instead of 8. I asked yesterday to come at 9:45. You are here at 10 o'clock. What is your rubric? What is your rubric? This is what is the case taking is that. Case taking is nothing more than that. Case taking is like that, understanding the human being, understanding the patient's nature with these qualities. This is the quality. If it has been told to you that you should be here at 9:45 and you are not coming at 9:45, it means what you are? You are frivolous. You are not taking the thing seriously. Gambhiryaने न घेणारा, who is not serious, frivolous. Another rubric, open Kent's repertory. You get the frivolous rubric, mind chapter, frivolous. Open it and find it out. Is it there? Frivolous. Frivolous. See, this is how a case starts. So, if the patient has taken an appointment, he called you, he is there right at that time. So again you have to think something. There might be anything. So with prior appointment on telephone, mobile, email, if the patient comes to you, then you have to think. This is just an inductive reasoning which you have to utilize. What is the reasoning? Reasoning is the process of thinking, विचार करण्याची capacity, क्षमता, method. Inductive reasoning means, don't say me a definition. Sir, going from particular to general thing is called as inductive reasoning. But what it means? It means you have thought, just look towards things and then you have reasoned a big thing. Only patient has taken very particular appointment and he is there at 8 o'clock sharp. Very sharp. And when he enters, looks his watch and looks your watch and then he comes and he says, Sir, I am there at 8 o'clock. You called me at 8 o'clock. You got one nature of him. How is the person? He is fastidious. Another rubric in your repertory. Kent's repertory. Open. You open it. Make it practical. Those who don't have the repertory, sit in a group so that you will get a habit of going through it. If you don't have a repertory, make a group of 2 or 3 students so that you can go through that if you don't have your own repertory. What the rubric? Fastidious. Fastidious is the rubric which has 4 important remedies. One is Naxomica, another is arsenic, third is carcinosin, fourth is aurum metallicum. There are many more, but these are 4 which are important. These are 4. Now, you got one rubric, fastidious. But what type of fastidiousness is there that you have to catch? Everyone has a fastidiousness with a different characteristic. Arsenic is fastidious, who is called to be a pathological fastidiousness, means he will come, he will settle this like this. Again after 5 minutes he will come, again do this. He repeats the act again and again. So arsenic is the person who has a compulsive disorder, because of which his fastidiousness is called as pathological fastidiousness or diseased fastidiousness. If he clears the room, he clears it 10 times a day, sometimes 20 times a day. This is what is called as an obsession or compulsive disorder. That type of fastidiousness is present in arsenic alcohol. Naxomica is fastidious, but Naxomica's fastidiousness is goal-oriented fastidiousness. Till you, this is my goal, yes, I am fastidious, yes, I will work hard for. Rest of the life, he is absolutely indolent, lazy. But for his goal, he is fastidious. Third remedy is aurum. Aurum is very particular, very meticulous. Everything arranged in a particular manner. The books are arranged in a particular manner. The appointment letters have been arranged in a particular manner. He is very particular with the time. He is very particular with each and everything. Methodical fastidiousness is of aurum metallicum. The fourth is carcinosin. Carcinosin is beauty-oriented fastidiousness. The carcinosin always looks how it will look beautiful. He arranges the things in a beautiful manner. He dresses himself beautiful manner. So it will be attractive enough and everyone catches the attraction. This is the carcinosin's fastidiousness. So these are the things which you have to induct. When you look towards the rubric, this is what you have to catch. So you can think about another rubric. Patient is very careful. Third rubric is cautious. Cautious means, what is cautious? Satar, very correct. Yes, what's time? Yes, I have to go, I have to reach. He is cautious. He is very cautious. Serious, earnest. This is another rubric, seriousness. These are all rubrics which you can catch. Just look on the first entry. This is what is the case taking is there. First entry, like you got these things and you got the remedies. Serious, earnest. See, he is very serious. Taking the things in a serious manner. So, see, this is what is called as an inductive reasoning with which you can understand the patient's nature. Ultimately, to whom you have to give the remedy? You have to give the remedy to the patient. You don't have to give the remedy to his disease. You have to give the remedy to the patient who is suffering from disease. So qualities of that patient are necessary to understand, and these are the qualities which you can gain under immediate entry. This is second. Patient never takes appointment. He directly enters in your clinic and asks to meet you. Then you have to think how this person is. He has not taken the appointment, he is not serious. You ask, why do you are here? No, I am going over here, I saw your board and I enter. What it means? What is that? I saw your board, I think I am having diabetes since last 6 years, so better to just return over there, you treat the diabetes. I am here. So what treatment you are taking? No sir, I am not taking any treatment. Again a rubric frivolous. This is the patient who is not at all serious about his disease. 6 years he is having the diabetes, he is not taking treatment. Just saw the board, entered in my clinic. This is what is the frivolous nature. The way he entered, the abrupt is the nature. Abrupt means all of a sudden if he enters, then abruptness is there. He is careless. That is another rubric, careless. He is not caring. Right? I have to take the prior appointment, I should go on time. He is not at all careless. If you would have given an appointment, he is not at all following it every time, careless. Doctor, you are the doctor, you treat the cancer, no? What type of cancers you have treated? Have you treated these types of cases earlier? If you don't answer, he will going to ask you same question again and again. He is the person who is called to be inquisitive. Inquisitive, curious. Another cross reference is curious. Inquisitive or curious. He will going to ask you many things. Then second, last, the person who comes in such a manner without telling anything. Let us see what is there inside. He comes lightly towards you. Just for the sake of understanding. Finding it out. Whether I will get a chance to get treatment over here. He is in light. He is in search of light. He wants to throw a light. See, these are the rubrics which you have to catch from the patient. These are the things which you have to perceive. That's why the word Hahnemann utilizes in his third aphorism. If he clearly perceives, this is how he starts third aphorism. Perceives is the thing. This is what you have to perceive. Just looking toward the patient. So here the case taking starts. There is no question. You sit like college, take a form and write it down. What is your name? Then what is your age? What is your sex? If you ask such types of foolish questions, that is not called as a case taking. Case taking starts anywhere, anytime. Even the way he enters. How a patient enters in your clinic. That is his behavior at the reception and in the waiting room. If you have a CCTV, it matters a lot for you. For a homeopath, I always say that CCTV should be there. Because when he sits in front of you, he is a different person. When he is not in front of your eyes, he is a different person. Patient enters. Dr. Ayazgar. Is there a doctor available? Receptionist, she says yes, she is there. I will ask. Then she calls you, then says, I send the patient. Came. Doctor, may I come in? See, here is the difference. The nature is changing. This is what is the case taking. You have reached to 4 remedies. There are only 4 remedies. What is the nature? The nature is called as one rubric: contemptuous, hard for inferior, kind to superior. There is lachesis, there is lyco, there is platina, and veratability. So everyone comes to you in a different manner. The entry is very important. The last word which is written over there is a pompous. The rubric is importance feels is pompous or pompous. What is pompous? Pompous is means I am someone. Pompous means I am someone. I am having some value. Tell doctor I am there. I am someone. It's pompous, proud. There are another group of patients who enter. Doctor, may I come in? He knocks the door. Doctor, may I come in? The nature is polite. This is politeness. He asks the reception. Doctor is there? Yes, I want to take the appointment. I want to meet him. The politeness in tone. You have to catch. The mildness in tone. Another rubric, mildness, you can catch. See, these are the things which you have to catch. The way, the dictatorial is the person who dictates. Dictates means follow me. Dictatorial is follow me. Here is the person who is talking to you in a gentle manner, mild manner. There are few people, they goes on talking to you or reception, they enter in the reception. Doctor, is there a doctor? How many patients are there? Sir, 2-3 patients are there, then doctor will meet you. Okay. I will sit over here. Okay. Sir, can you sit over there? Yes, I will sit. You have observed it in your CCTV display. You have observed how this patient has behaved. This fellow has behaved. What you have kept? Obedience. Okay, agreed. Also, anything. The way receptionist has told, he is following. He is yielding nature. This is what is called as a yielding nature. But at the one thing, if you have catch, then you would have catch the remedy. Can you see? Yes. I will see. Sir, what's your name? My name is so and so. Okay. So, is it possible for you to wait for some? Yes. No problem. Yes. This is something which gives you a case. Answers nodding by. Single remedy, pulsating. Answers nods by. This is the rubric in your repertory. Answers nods by. This is nodding. So see, case taking is the art which you have to catch and perceive. You have to catch, yes, this is what the patient is being. Audacious, there is a word. Audacious. What is audacious? Audacity rubric, is it there in their repertory? Audacity. It is the audacity. You will get marks all over there. Audacity means उद्धट. मराठीत उद्धट म्हणजे the person who will not going to give a civil answer is audacious. There was one case. I will share the case. Experiences. It's not a joke. It's a reality. There was one patient who came early in the morning in my OPD. I asked him, what's your problem? He said, doctor, since morning I have 10 to 14 times loose motions. The way he talked. Second important thing, this was a young male person who talked like this. And second thing, the way he talked, I asked, what is your next question? If patient comes to you with diarrhea or patient comes to you with loose motions, what is your next common question you are going to ask? What is common sense? What is logic?
Abdominal pain. Abdominal pain. Do you have
Abdominal pain. Anything. What you have to confirm more clearly? काय ठरलं होतं त्याच्या आधी what is more important? You have to differentiate one important thing, whether it is diarrhea or whether it is dysentery. So what is your next question? How is the stool? That is your question. संडासला कशी झाली? This is a simple question on which you can differentiate. Patient has answered, doctor खाली वाकून नाही पाहिलं. Answer is civil? No. This type of answer is called as audacity. I have prescribed him mirth and next with one dose only he has settled, because the mirth nature is like that, they will not going to talk like this. It is his duty to answer whether it is watery, whether it is sticky, whether it is liquid. The answer is not civil, audacity. So behavior, you can catch such type of behavior. There are some patients who enters in your clinic without asking anything, they start communicating with you. Doctor, I was going from this place, I saw there were no patients, so it's better to consult you and talk to you, and so you have time, I will going to start. He goes on talking to you without putting question for what purpose he has come. It's a communicative. So there is only communicative expansive. If he is jumping from one idea to another idea, then loquacity. But if you have started communication and he is going continuing it, it is communicative expansive. Communicative expansive. So this is the way case has started. Is it clear? Are you getting it? Things? Sure? Okay, if you don't understand anything, let me know immediately. Sir, I have not understood this thing. You can talk in Marathi also. But as it is going on live also, so that's why I am trying my level best to keep it more and more in English. Okay? Third, how a patient enters in your specific cabin. He has entered in clinic first, then he enters in your cabin. What are things which you have to look for? The first is his gesture, his behavior, his nature at the entry. There are many varieties with which patient comes. They enters, doctor, may I come in? Enters, sir, namaste. 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 This is something which is very important. Everyone will not going to do that. Then the rubric is reverence for those around. It is there, reverence for those around. This is the rubric in King's Repertory. Open the Repertory. Yes, Salpa is there. Reverence for those around. Yes. So, on entry also you can get that. When he enters, the way he behaves with you, the way he sits is matters. He comes like this, he sits over there, he takes the chair, he sits and he keeps the hands on this. Yes, doctor. And he is looking directly, eye to eye contact. He is dictatorial. He is a person having having an ego. The person who behaves like this. So every gesture matters a lot for you. The way he starts case taking, the way he starts speaking with you matters a lot. How he starts. There was one patient who came to me early in the morning at 9 o'clock. Old man, around 60, from the village. That feta was there, everything is typical farmer. So what is the question with which you start with the people, talking with the people? How do you communicate with the people? What do you ask to the people? If you want to talk with me, if you don't know me, what do you do? First important thing is always to greet, namaskar. Namaskar, this should come from your heart. Then you start. So I just saw namaskar baba. काय आलं माझ्याकडे काय होतं म्हणून. This is a simple question with which you start communicating. This fellow was again a similar type of personality. What is the answer? ते कळत असतं तर तुमच्याकडे कशाला ब्लॉक केस टेकिंग ब्लॉक नो मोर केस टेकिंग. What you will do? If such types of patients are there with you, how will you approach? Always keep it in your mind, don't get dominated by the patient. You should dominate the patient. Ask, okay, agreed. Do come, lie over there. I checked his pulse, I checked his blood pressure, I just put stethoscope. Ask, Prerna, give this medicine to him. Oh, doctor, तुम्ही कशाला औषध देताय? What you are doing? I understood what you had. No, oh doctor, मला नाही असं म्हणायचं. Then he came down. You should not get dominated by the patient at all. This thing always keep it in your mind. And then start. But what nature you have got? Audacity. Again the rubric was audacity over there. The way he has talked with you. So there are many varieties of people who comes to you. Varieties. They enter in your clinic in a different way, where you can grasp the nature of the person. That nature gives you a real idea about the patient. And that's why entering in your cabin matters a lot. Fourth point, whether patient starts narrating his problem or whether attendant starts explaining about it. Two things. Sometimes patient comes, he sits over there and you ask what is your problem? He is never. What is your problem? What is this? What it means? If then the attendant said, doctor, he was not ready to come over here. I have purposefully brought him towards you. Two important things which you have kept. No, timidity means it is a bashful, cowardice. He is not cowardice. In fact, he is looking like this. No. He never liked that. He was not thinking coming over here. He was specifically brought by the parents. So, undertakes things opposed to his or her intentions. Open the repertory and see the rubric. Undertaking things opposed to her intentions or his intention. Only a single remedy is given in Kent's repertory appear in complete phosphorescence diagram. Is it there? Undertaking things opposed to her intention. Okay. Another thing which what this indicates? मला यायचं नव्हतं. Mood repulsive. Another rubric, mood repulsive. Mood repulsion. There is no interest. There are many things which you can catch. This is what is the case taking is there. Some patient starts narrating the symptoms, some patients absolutely sits like this. You ask, what is your name? Prasad Rasal. What is your age? 51. What do you do? Doctor. Why do you are here? I am having it. So, what aggravates your complaint? Son. What you got? See, this is the technique of case technique. Here, something you have grasped. Answers in monosyllables. There is a rubric. Answers monosyllables in. See, open. Yes. No. This is how the people talk. Is it the rubric available in Kent's repertory? Answers in monosyllables. There are people who never wants to talk at all. Even in their house, they never talk so much. Those who used to do more intelligent work generally talks less. Even in their house, they are always having a very less communication with others. These are the personalities. Their wife tells, "Doctor, आमच्या यांना सांगा ना काहीतरी, ते काहीच बोलत नाही." This is taciturn. Talk indisposed to be taciturn. This is the rubric. Talk indisposed to be taciturn. There is another thing. There are certain people who talks like this. Doctor, I want to tell you something, but I will tell it later. They talk. First sentence they talk, and then all of a sudden they take it. That is their secret. They don't want to make it open now. That is secretive nature. That is another rubric which you can get. Secretive. These are few different differentiations which you have to catch. Reserved means your bike has a reserve petrol. What is reserve? When it is necessary, then only open the things. Reserve means those persons, those keeps inside, and when time comes, then they talk. That is reserved. Okay. So you have to catch. Here, one more rubric is there. Doctor, I want to tell you something. But okay, hide desire. Another rubric, hide desire. Hide म्हणजे काय? लपवून ठेवणे, जपून ठेवणे, लपवून टाकणे. And there is another types of people who enters. Doctor, तुमच्यापासून काय लपवायचं? काय? Not talking. Doctor, तुमच्यापासून काय लपवायचं? Naked wants to be. Doctor, this is the nature with which patient expresses. Even those people tells you certain things which one should not tell. That comes under the naked wants to be. There are some certain persons, specifically the village peoples or some even from the cities also, they comes and talk so much in your OPD, even outside you have to ask them, please keep quiet. And they go again after 5 minutes they start. In the class, what do you do? This is your rubric. Noise inclined to make your noise. Noise inclined to make noise. Noise inclined to make. This is our another rubric. Certain persons talks like this. डॉक्टर मला काय वाटतं ना, मला असं वाटतं म्हणजे मला असं वाटतं म्हणजे दिस इज माय थॉट, माय थिअरी, थिअरायझिंग. दॅट इज अनदर रुब्रिक which you can catch. मला असं वाटतं, you got, if he utters 3-4 times, this fellow is always theorizing. Theorizing is another rubric. Just now elections have been passed. You have watched the videos, number of things. There are certain people who talk like this. मी नाही म्हणत हे काय लिहिलंय बघा. This they gives proofs regarding everything. This is what I want to tell. आपल्या भगवद्गीतेत काय सांगितलंय बघा. हे सर्व त्याच्यात लिहिलं. मला नाही, मी नाही. Philosophy ability for. They are telling you philosophy, different philosophy. This is another. See, case taking. This is what is the case taking. Is it difficult? If you are getting in a habit of getting all those things, perceiving all those things, it becomes rather simple to judge the patient. Same thing is that you have to deal with the patient. Your eyes should be open when whatever you are watching. If you are watching television, your eyes should be open. If you are watching serials, if you are watching movies, you are there in the crowd. Just go and observe what they are talking and what is the rubric. What is his nature? How I will convert it into the rubric? How I will find it out? These are the things which you have to look towards. Objective reasonable. What is your problem? If you ask question, what is your problem? Doctor, what has happened? Yesterday I went on bike to Nasik and I got lot of draft, and because of which today I got the cold. You are asked what is your problem? Answer is I am getting cold. But what is happening? He is coming to the object after reasoning a lot of things and then coming to the order. Objective, reasonable. That is another rubric which you can catch. This is the nature of the person. Certain persons always talks like that. You ask them any question, they always give the reasons question. They never directly answers what is the problem. They directly every time give you reasoning. This is what is objective reasonable. Safety objective reasonable. Sulfur is not objective reasonable. Sulfur is theorizing. Sulfur is there with philosophy, but safety is objective reasonable. Answer aversion to. That is one more thing which you can get in your case taking. You ask the question and they don't want to answer. Broadly you can tell, but you have to find it out why he never answers. There are many reasons behind the not answering your question. Either he may be forcefully brought to you. Either he is not interested in taking the medicines. Either he feels he is not having any disease. There are many reasons. Those reasons you have to catch because his nature is hidden over there. What is the nature behind that you have to catch? Not only just answer aversion to, the reasoning behind answer not having an answer. Whether patient is forced to take the treatment. This is what already we have discussed. Undertake things opposed to his intentions. Aversion to take medicine. There are patients who never likes to take medicines. Doctor, are you going to stop my medicines? I will be there with you. If you stop my medicine. They never likes medicines. That is answer. Aversion to take medicine. There are certain patients who are always dominated by their parents and which you can catch. There are many ladies who were getting dominated by their husbands or vice versa. In your clinic you catch that. Both things are you can catch. There was just 10 days back, there was a patient who came to him for some problem, and if I ask any question, his wife was answering every day. So you have to catch who is dominating, and problem is because of that domination. Whether patient comes voluntarily to take the treatment and what he expects. He himself desires to take the treatment, that is most important thing, and whether what he expects from you and how he takes the treatment. So whether he is sincere, whether he is cautious regarding his disease, that's why he is there. He was diagnosed, yes, there is some change in your tissue, so we have to go for investigation. Then patient comes to you, doctor, this fellow has told me like this, you please check me whether I am having the problem. So certain types of patients comes to you. Sometimes patient comes to you directly and he says, doctor, please check my body. So you ask, what has happened? Why do you want to check? Do you have any problem? No, I don't have a problem, but my neighbor died because of hypertension. What is the thing? What he feels? He feels that he might get death because of hypertension. He comes to you immediately. The main concern is fear, but regarding what? No. Death of big rubric, open the repertory, fear death. How many remedies are there? It is a superstitious fear. Whether he will going to get the heart attack and he will die? No. It is a superstitious fear. Single remedy is fear superstitious. Rest off. Only remedy, fear superstitious. Rest off. Okay? So this is one way of understanding the patient. So I have taken certain overview how the patient enters and how will you go for the case. This is one aspect. There are many aspects in case. Many aspects with which you approach towards the patient. So we just go towards another understanding of the sick. This is the case. Just go over there. Are you able to read this time? So this was a case of anesthetist from Sangamre. It is nearly about 7-8 years back, or even 10 years I remember. 40 years old who was operated for THR, total hip replacement for post-traumatic AVL. Post-op, he developed tremendous neuralgia with very severe burning and stinging pains, which was not responding to any analgesics, even to carbamazepine. He was literally crying due to the pain, and I was called to his house for homeopathic care. And he was literally crying like a child. So much severe pain was there. He has taken carbamazepine, he has taken protein-argon injection. Being an anesthetist, he knows all the painkillers. He has taken everything, nothing was working. And this was after 4th or 5th day after operation. Now operation was total hip replacement. THR was done. So he has operated, and this is the case. That's all. What should be your approach to deal with this patient, and so what's the remedy? I went over there. I saw he was crying with pain, and the pain was so severe. It was neurologic, pain, everything, and he was crying. Now here intelligence comes into the play. If you would have read your Madhyamedika properly, you got it. You got the remedy. What is THR, total hip replacement? Total hip replacement means hip joint. It has been totally, first earlier joint is broken, taken out, and then a prosthesis was added over there and fitted in the joint. So what do? They cut the leg. They ampute right from the upper head of the femur. upper head of the tumor, there it has been cut and then the prosthesis is added. So here, what is the logic and what is the characteristic symptom? That's what you have to catch. I have given that remedy. Allium Sipa. Neuralgic pains like long thread, infaced neck, chest, traumatic chronic neuritis. Neuralgia of stump after amputation. After amputated the leg, the neuralgia persists, burning and stinging pains. Allium Sipa, very simple remedy. Prepared from raw onion. A very simple remedy. No one thinks about it for such a thing. Because we think allium Sipa, acrid chloride with bland lacrimation, finished, that's all. That is the only thing for which we know. Allium Sipa is a remedy for many things. For paronychia, nakurda. It is another very important remedy for it. It is a remedy for cucumber colic. Pain in abdomen after eating cucumbers. Allium Sipa is one of the important remedy. We forget rest of the thing. We keep in our mind in exam for what purpose it is asked. We do study from exam point of view. We forget rest of the thing. I have given Allium Sipa 1 mTds, and it was surprising that next day there was a call. Next day there was call from patient that he slept well at night, which he was not since 3-4 days, and he is feeling better about 70%. And within 7 days his neuralgia recovered completely, totally. So this is what you have to catch. Case taking is not that every time you write it down, what is your name, address, all those things. It is not case taking. Case taking is that to visualize, yes, what you get, what you have to catch. How will you reach to the right simillimum? That is what is the case taking is there. So in this case, if you would have catched properly, then you get the Allium Sipa. Otherwise, you go on giving n number of remedies, arnica, nothing works, hypericum, nothing works. Because you have not got the thing which is needed. So case taking is like that. So question arises, what is the case? If you are dealing with the case taking, what is the case? So what is the case? It is in English, not in Marathi. No, what has happened? There was a joke which has happened in our OPD. The patient came for hair fall, so there was no time. So I asked him to, you will get an appointment in the afternoon. My assistant will take your case and then we'll deal. And he came at right time. Your teacher, Dr. Ajit, was there, who is learning with me. He went away, he took his case, and after finishing that, he asked the Ajit, that fellow, "But तुम्ही case घेणार होते ना माझा?" This is how this has happened. So this is English case. Case is nothing but understanding the human being. Every human being you have to understand. And how do you learn the human being? Case taking is understanding the human being. How will you understand the human being? How will you know next person? That is through perceiving. You have to keep your eyes open, you have to keep your ears open, you have to look towards any number of things, you have to gather the information, you have to catch, you have to analyze, you have to compare. This is what is the perceiving is. This is how you have to go. So perceiving is like that, and perceiving many times requires additional help of communication skill. That is another aspect which you have to utilize. So with anyone you can communicate. Only thing is that you should be very intelligent and tactful. Tacts you have to use. There are small children who used to come to you, but they are always in a fear. What this fellow is going to do. This is always there. They are always brave outside. When they enter in your consultation or in your clinic, they start crying. Why? Why they cry? When they enters in, they immediately catches. They are very much perfect perceivers. They perceive what they might get an injection. So fear injection off. Is it there? Is there any rubric fear injection? There is no rubric fear injection. Injection is nothing but an injury. So it is the rubric fear injured of being. You get many more remedies. One of them is tremolo. Fear injured of being. So they comes to you and they are very in a fear, frightful mood. There is fear in their mind. They might get. That's why they cry. They never approach. If you look towards them, they immediately turn their neck. Evades the look of physician. That is another rubric. Evades the look of physician. Third thing, they grasp their parents. Grasp on their parents. If you just try to touch, no. Clinging to those around, clinging to persons or furniture to another stremonium. And what do? If you start going towards them, they pray, no, go out. Escape desire to. Again a stremonium. So this is how, and then how will you talk with this fellow? He is not in a mood to talk to you, how will you make him talk? You have to keep many chocolates, but you will going to finish all of them. You will not keep them for the children. Better aspect of chocolates is our small globules. You have to show those globules, and you have to give few of them without medication to him or her, and put there in their mouth. And once they eat one or two, then you ask, do you want more? Then they start answering your questions, a number of questions. You ask and they are ready. You give every time only one. This is more important. But they will answer. These are the things which you have to use. These are the communication skills with which you can approach toward them. With everyone, the things are different. Those who used to attend my clinic, they would have understood up till now that every time I never talks regarding only with the disease. I talk to them with many aspects. The election was going on, I was asking, so what do you feel? How is the condition in your town, in your village? Because these are the things with which people becomes open to you. They are quite open immediately. If they like that topic, they start communicating you. So with everyone, you have to ask the things in a proper manner. There are many things. One more thing is that appreciate the next one. Your dress is looking quite good. Immediately you feel better. This is the thing which happens if you appreciate someone. They always like. If you want to talk with the students or you have to explain them something, then always make a habit in your communication, that always appreciate their certain qualities. Then whatever you are going to say, they will listen to. This is very important thing which you have to do. So to perceive and communicate better, what required is physician should have sound senses and unprejudiced nature. Hahnemann, he has told in 83 aphorism 4 qualities. Specifically for chronic case taking, he has explained 4 qualities for the homeopathic physician. Which are 4 qualities? Which are 4? Freedom from prejudice, sound senses, attention in observing, fidelity in tracing the picture of disease. These are 4 qualities which he has mentioned in aphorism number 83 for taking a good case. Out of which these 2 matters a lot. Unprejudiced nature. Unprejudiced what? Why unprejudiced? Because many times it happens that with certain thing we become prejudiced. Looking to a thing immediately we get prejudiced. And answer might be different. So whenever you are doing homeopathic practice, always better to keep your eyes open, to listen properly and talk with the patient, observe the patient, make a clinical examination and then come to the conclusion. That otherwise that joke is quite common with the doctors. So one doctor is coming, one fellow is coming from distance and he is walking like this. And then there were 4 doctors who makes their confirmation. One doctor who was neurologist, he says that he is having teledorsalis. Another doctor, he says no, he had a fracture of hip and operated because of which he is walking like this. The third fellow, no, he is having diabetic neuropathy, that's why he is walking like this. This is how he comes. They decide that who is intelligent for all this. And then patient, that fellow comes and he asks, is there anyone who will, if anywhere I can sew my chappal which has been broken? Finished. Prejudiced mind has finished everything. No one is intelligent. So this is how it happens. It should not happen like that. That's why prejudiced nature. So what happens? Problem happens when we learn the matter remedy. We learn the matter remedy of first remedy pulsatility. So it has been taught pulsatility is a VP remedy. Beats up every time. Then you learn sepia. Again you got beeping remedy. Third remedy it has been taught in the class Ignatia. Again a beeping remedy. Then fourth remedy comes, Netramure. Again a beeping remedy. And you know only 4. And patient comes and starts sleeping. Then your condition is कभी तू पल्स लगती है तो कभी तू सेपिया लगती है कभी तू इग्नेशिया लगती है तो कभी तू नेट्रम लगती है. This is what happens. This is the problem because of prejudiced mind. So you should not get prejudiced. That is more important quality. And second important quality, sound senses. Specifically 2 important senses are more useful for you. First is listening and second is observing. Third also important is smell. That is third important. Fourth is touch. That is sometimes useful. And last, not at all useful in just taking is using tongue. Okay. So 4 are very important senses which you have to catch, which you have to utilize. So these are things which you should be very alert regarding this. So we'll go further. There are many people who are coughing nowadays. They come to your clinic and they are coughing. And every time they cough, everyone's cough is different. They are sitting over there, you get remedy over here. Only you have the capacity to listen how they cough. Patient comes. They cough like this. What is the rubric? What is the rubric? Cough, sudden paroxysmal. Cough chapter, sudden paroxysmal, consisting of one cough is Calcarea cough. It is not given in Kent's repertory. Kent's repertory 2 cups is given, 3 cups is given, 2 successive is given, but 1 cup is not given in Kent's repertory. It is incomplete and synthesis. The remedy is calculated. So this is the rubric which you can get over there. Cup paroxysmal consisting of 1 cup. Second, cup paroxysmal consisting of 2 cups. Two paroxysms. You get 14 remedy. But there is another one more rubric who comes like this. Coming in a very fast way, in sudden paroxysms, there are only 3 remedies: murk, surf and sulfur. Cup paroxysmal consisting of 2 cups, quick succession. Yes. Only thing is that you know the remedy but take the whole case. Otherwise you will not get the money. There are certain patients who comes in 2 or 3 paroxysms. So sometimes 2, sometimes 3. There are 7 remedies. Specific 3: belladonna, carbohydrate, cuprum, phosphorus, tannum and veratrum. Specific 3. So these are the hints, these are practical hints which you have to catch. Very important things. Sound senses means these are the sound senses. 3 or 4 cups. Paroxysm consists of 3 or 4: belladonna, carbohydrate, cuprum, tannum, veratrum. Okay? Bore nasal? Are you getting bored? No. This is just start. There's another thing. There are many types of frowns on your face. Asabagnar lokas. Whatever answer they give like this. This is how this happens. Knits their brows together. It's called as knitting brows together. Is called as a frowning. Frown disposed to. Marathi kapala or cat. There are 16 remedies. Frown disposed to. It is the rubric given in mind chapter. What frown means? Frowns are meaning ka if someone frowns.
Question.
Is it real? Is it the thing? This is how it happens. When you don't agree, immediately you frown. Frown disposed to be angry, equisetum. Equisetum, single remedy. He is not only frown, he is angry at the same time. Frown disposed to be contraction of skin of forehead from whole forehead is contracted, sanicular. It is sanicular. Frown disposed to knitting his brow. Knitting म्हणजे काय? Knit together. एकमेकांच्या खूप जवळ आणलं. Helleborus viola odorata. So these are different things with which you can approach towards the case. So whenever you have to learn homeopathy, you have to study the human being, you have to take the help of most important subject, that is the organon and homeopathic philosophy, which teaches you to look towards the human being, the angle. So it is not only the mind, it is not only the body, it is not only the soul, it is not only the vital force with which you have to learn the human being. There are many human beings having multi-dimensional aspects. There are many facets. How the human behaves with different types of people. There are many facets in case taking. So it is not monotonous and it is not in one way. Many facets. Any time you can get a case. So it is called as a multi-dimensional aspect. You should not be rigid. This is the method with which you have to go ahead. For every case, the facet is different. So let us learn one more case. This was interesting. This case was an old one, but just now, 1 month back, I got similar type of case. Case was very similar. A 60 years old female diagnosed with cystitis with severe tenesmus, constant urging, dysuria, hematuria, burning micturition was brought to me. Urine contains lot of stringy mucus. Urine examination shows lot of RBC, pus in the report. That's all. Nothing more than that. This is the case. That's all. Nothing more than that. What should be your approach to deal with these patients and what is the remedy? Is there any characteristic? Sometimes it happens that we don't get a characteristic because we don't look towards the whatever given things with the characteristic way. Our attitude to look towards such things matters a lot. If you would have brought the Borix Remedica, open the Borix Remedica, there is one remedy. So this is a pathological case and the symptoms are called to be a pathological symptoms. All symptoms are pathological. So remedies, 4-5 sentence remedy, it is Uva Ursi. Uva Ursi. UVAURSI. Open the Borix Remedica and just see. So what is given in Borix Remedica? Urinary symptoms are more important. Cystitis with bloody urine, uterine hemorrhage, chronic vesical irritation. Vesical म्हणजे काय? Bladder. Chronic vesical irritation with pain, tenesmus and catarrhal discharges, burning after the discharge of slimy urine, pyelitis, calculous inflammation, urinary. There are very specific symptoms. Frequent urging with severe spasms of bladder, burning and tearing pain. Urine contains blood, pus and much tenacious mucus with clots in large masses. This is very important. This is what the remedy is there. Uva. It is a wonderful remedy. If you want to tackle the UTI, the pyelitis, wonderful remedy. Give Uva in 30 potency in repeated doses and it works very fast. Just 1 month back, there was a patient from the Sirampur and he had plenty of pus in urine. He was an old man, prostatitis with pus and I have given Uva and within 3 days pus nil. This is a wonderful remedy to be utilized. So Uva 30 QID for 5 days was given and it was covered so nicely. It works like an antibiotic. There is no need to give Ciplox, no need to give the Norflox or any other antibiotic. So case taking sometimes you get in pathological symptoms also. Pathology itself is sufficient to give you, yes, this is the remedy. Only thing is that whether we have read the Remedica like that. Upon Remedica तसं वाचलं का? We have not read many times Remedica like this. If we read it properly, we understand the depth of the Remedica. Follow, second day the burning micturition much better. Fifth day urine passed without any trouble since yesterday. Urine routine exam normal. So when you deal with the patients, there are physical aspects which you have to take into consideration. Sometimes mental aspects, sometimes universal aspects, patient's relation with the universe, and sometimes the spiritual aspects also. That gives you certain entity regarding the certain aspects of human being. That gives you exactly how the person is. So anywhere you get the case, anywhere you get a remedy. Individualization at physical level sometimes you get. So we will go further. See, it has been said that portrait is very important. 6 step horizon. काय सांगितलं? Portrait खूप महत्त्वाचं. Portrait म्हणजे what is portrait? Portrait means हुबेहूब चित्र. It is as similar to it, very similar. Portrait, characteristic. Now you just see and you tell who is the. How? Party. You know him because you have catched the characteristic. So one by one, if you get this, you can catch it more perfectly. If you get third, you are damn sure about it. Then you get more than that. You are more knowing fixed about it. Then you get more than that. So one more characteristic. This is gathering together the characteristics gives you the portrait of the individual. And you are damn sure who is there. So non-violence. This is what is called as totality. You get the totality of this pure. This is how you reach. Yes, this is the case. This is the person called to be a Gandhiji, individualization. And this you have to do in case taking. So physical aspect and physical constitution plays very vital role in understanding the human being. So at least from your naked eye, what you catch? तुमच्या उघड्या डोळ्यांनी तुम्ही काय काय कॅच करता? What you can observe. So what you can observe? Tell me. Which are things which you are going to observe? Huh? Zoro. Constitution. But other behavior. What things which are observable to your eyes? Someone patient eye. काय का पाहणार? First important thing तो मुलगा है तो मुलगी है. Start with simple, then end with the complex. Okay. Second thing, simple things, because constitution of every remedy is given in first sentence. Tall, slender, weak, emaciated, narrow-chested. Patient is there in front of you. Then you are coming to the phosphorus because you know phosphorus is like that. But you catch that on the basis of knowing the things are weak. So you have to understand first what to watch. So each patient is tall, slender, weak, emaciated, narrow-chested. Question is narrow-chested. Weak माहिती है, emaciated माहिती है, tall माहिती है, slender माहिती है. But you don't know narrow-chested. What is narrow-chested? Special narrow-chested. Generally, the thoracic span is equal to abdominal span. Normal human being, thorax is this much and abdomen is this much. It is as good as equal. Little bit less is abdomen, otherwise it is as good as. In persons who are narrow-chested, the thorax comes down and abdomen enters inside the thorax. Is called as narrow-chested. You go on observing abdomen, you come over here and then you get the abdomen. Otherwise only thorax. Only the ribs and ribs and ribs and ribs. This is narrowness, narrow-chested. And then you come, this is tubercular myelin. This is phosphorus. So constitution gives you certain aspects looking toward the patient. Another comes who is absolutely fat, fair, flabby, good, chubby. You got the thought of calcareous. So there are many varieties. we learn one by one. And to pursue constitution, physician should be a keen observer. Now you can see many aspects of it. The children who are there, whom you bore. First important thing, it is not aurum. This is injustice to the aurum. It is arum. Aurum is not like that. Arum is plant remedy, aurum is gold remedy. So, but arum triphyllum does it whenever he has the chloride. Otherwise, he never does that. But here, child is brought to you, and who is bowing his fingers in the nose. Then you have to open the repertory, see the, and remove the prejudice that it is only single. There are 40 remedies. Boring the nose boring with finger, 40 medicines. Right from anacardium to ginkgo. So see, just observing you got certain thing. At least from 3000 you are reached to the 40. You ask the question to the child, and child looks towards the mother. How Barata? Barata will do this. Barata will not do. Barata will not going to answer you. Barata will not going to answer your mother. The rubric is mind speech whispering, answering to mother instead of the prescriber directly is solution. Single remedy solution. You catch this. This is the case taking. This is what you are getting in front of you. Somewhere this child is doing this activity. You have to give remedy to the child, not for his disease. This is what you catch. This is the keen observation which you can catch. But एकदाच त्याने असं कोण असं केलं, immediately don't take that rubric. Every time you put question and he answers like this, and he is not answering directly. He is going towards the ear and then talking. That's what is called as whispering. Whispering means kuz-kuz. Whispering, kuz-kuz. Talking, muttering, just. What is this? 4 circles. What is this? This means this is the constitution which is called to be a psychotic constitution where neck is absent. Some certain people look like that, they are short stature, don't have a neck. So this is a typical psychotic constitution. Like Puja, short neck, pot bellied, obese, short statured, very typical. You get it many times. Nowadays I have not seen because I have not gone to medical store, but previously they get milk bottles, and that bottle is like that. मध्ये अशी मोठी असायची, दोन्ही बाजूने तोंड बारीक झालेलं असायचं. This type of bottles, very typical of psychotic bottles. Psychotic constitution models, very difficult. These are psychotic personalities, looks like that. These are upper teeth. वरचे दात आहेत. म्हणजे this is lower part which is visible. The inside part is not visible, but it is dark. It is completely garish. X-ray shows this is garish. Externally they looks good. Again a psychotic entity. Root of the teeth is carried. Decayed, psychotic constitution. Remedies are Puja, Meserium, Cilicia. These are most important remedies. But opposite visible to you. Now the same teeth these are lower teeth. Now the teeth, lower teeth, and crown of the teeth is decayed. You are observing it directly that caries is there. Patient ला सांगितलं, you just open the mouth and you see the caries of all the teeth. Crown of the teeth is decayed. Syphilitic constitution. Remedies are murky and statisagria. So see, these are simple things which you can easily catch. Now do you feel that homeopathy is difficult? It's simple. When you look towards the things in a simple manner, it looks to you simple. Make it simple, make it understanding, then it becomes rather simple. This is notes, consider. There are some people who have very long nose, and there are some people who are having very big knob like nose. There are two types of nose. What it signifies? It signifies pointed, long, sharp, knobby tip nose is the syphilitic aurum metallic. This is aurum metallic. For example, in complete repertory, one more remedy is added, calcarea, but earlier repertory only aurum was there. See the nose. This is pointed, very sharp. Syphilitic miasm has twofold existence. One is very good, one is very bad. Good goes towards it. So you can catch certain things. What do you observe? How is the nose? How is the face? Knobby? Frontal bossing. पुढचा भाग पुढे आला. नाक आत खाली गेले. Depressed nose. Typical African noses are like that. That you can observe the depressed nose, short nose, frontal bossing, attitude, naktanak. Very characteristically a syphilitic constitution. Very typically a syphilitic constitution. Okay? What is this? Huh? This is called as craving. Craving for tobacco, desires, smoking specifically. You get very few remedies. Those who are chain smokers, you can get specific rubric and you get remedies over there. Statisagria is one of the important remedies which can stop such types of habits. So you should be very watchful. When you deal with the patient, when you observe certain things in the society, you catch them. So this is too important. What is this? Observe. Right now it is the exam time. Now this is your examination. This is the case finished. What is your case? What is your answer? Observe, keen observer. Homeopath बनायचं? You have to become homeopath. See, what do you observe?
Attract करते.
Huh?
Attract करते.
बोला. काय चुकलं तर ते बोल. It doesn't matter. Anything, any specific thing? Huh? I don't want remedy. I want what you observe. Don't become prejudiced with remedy. You become first acquainted what is there. What you are observing. A simple thing, his left leg is only working, right is not working, it is right facial palsy. Simple thing is that it is right facial palsy. It is so simple, you are not observing. This is called as an unobservation. Your rubric is unobserving. That is one rubric, unobserving. It is there, but you are not getting it to observe. So, face paralysis, right? You get this much of remedies only. This is one way of looking towards the case. Okay? We'll go further. Now tell me. Blinking of eyes. There is no rubric like blinking in repertory. It is called as winking. W-I-N-K-I-N-G. Winking of eyes. Again, you get winking, eyes, inclination, frequent. So only remedies carcinosin. Only remedies carcinosin. How? What do you observe? He's saying love you. What is there on face you catch? Guys, observe. This is what is the catching the emotions, perceive. What do you observe on face? Huh? Surprise, huh? Correct. What is the word which is better than surprise? Astonished. Astonished face. This is astonished. Mind astonished. Cannabis indica, corellium rubrum, fluoric acid, igneous, tremonium. Once you make a habit of learning the things in similar manner, you never forget. Make a habit, making it simple, finding it out certain things and correlate it with it, then it becomes quite easy to catch. Very easily, you never forget. Wow. In children, case taking is very simple if you learn these things. They cry. Crying piteously. This is called as piteous crying. Piteous crying. Mind weeping, tearful, mood piteous. Chamomilla, sinus, tremonium. Only 3 remedies are there. Only 3. Chamomilla, sinus, tremonium. 3 remedies gives you everything. So this is the importance of knowing just a physical. You are not yet reached to the mind. You are not gone toward the mind. But you get ample things from the just physical testing. You are watching and catching the remedy. These are things which are very important. Now tell me this. You should like this, but you are not. Actually, you should be like this. Wow, seminar, I will going to learn this. You should, but you are not at all. Seminar. Under texting the post-presentations. So what is it? This is an ambitious, dreamy case. A very nice song. छूने की आशा आसमानों में उड़ने की आशा दिल के छोटा सा होम्योपैथिक से मिला songs makes her happy and we get again another energy. So there is a rubric, mind ambitious, much ambitious, 37 remedies. And last. Now you tell. Now you tell me what is the thing? What are the things? Now you have become keen observer. Anything? Huh? What you are observing? Trying to talk. Okay, Hasan. Winking of eyes, protruding tongue, slanting eyelashes like mongols, chubby baby. See, these are the things which show certain entities. These are the quite common things in dwarfist children. This you can get in dwarfist. Mongol looks, this is called as. Rubric is mouth protruding tongue, 58 remedies, like from syndrome to Viscomalco. So, this is one way of looking towards the case taking. Physical aspects you catch, specifically in children, infants, and those who are in ICU, who are in comatose. Then you have to be your eyes give you the remedy. Then you have to pursue. You are not going to get any guess, or you will not ask question. Are you winking your eyes? You are winking your eyes like this. And you are asking, are you winking your eyes? It's not the question. It's the perceive. And this is last. What is this? Huh? This is the very important thing. Two things. There are two important things. What is there? It is not fixed. It is moving. It is moving. If this child this infant sleeps in this specific position without moving his pelvis, then it is sinner. This is called as knee chest position. This is knee chest position. Sina baby always sleeps in this position. But now this child is not sleeping in same position. He is moving his pelvis. So if he sleeps in that position, Sina baby position. But for this specifically, there is a rubric: sleep position, abdomen on, convulsively spasmodic, throwing up the pelvis. It's cuprum metal. It's cuprum metal. So see, you should be very careful and cautious regarding the case taking. You should enter into minute details. Just put on gives the Sina. It's not like that. There are many remedies. If you open Repertory, sleep chapter, open the chapter, sleep. Today also done sleep, there is a rubric position. Sleep chapter, rubric is position. First sub rubric is abdomen on. Sleep, main rubric is position. First rubric is, sub rubric is abdomen on. And how many remedies are there? Many more. So what happens? We make fixed Sina photo. No. There are many remedies who sleeps on abdomen. Lycopodium also sleeps on abdomen. Belladonna also sleeps on abdomen. There are many more. So it should not become rigid. If you read that sleep position, then you will find your remedy. Just go through that rubric, you will get your remedy. There are many varieties. Someone sleeps like this, keeping hands over their head, pulsatica. Baga. Then there some people sleep like this, keeping hands behind the head. There are many positions which are declared over there. So what to do? You will ask the parents, how do your child sleeps? If the parents are sleeping with the children, they know the position. But there are high society people who ask their ayah, how my child sleeps. This is what happens many times. Better, whenever he sleeps, ask them to take a photograph and bring it while coming for the next consultation. You get the right position. How the child sleeps regularly. In that position, you catch the photograph. That is very important thing. Okay. So these are the things which guides you in certain physical aspects. So one aspect we have learned is the physical aspect. There are few more things regarding physical aspect. Patient comes to you with sore throat. You ask, allopathic OPD, how do they see patient? What do? They take the torch, puts it in your throat, mouth, and just see how it is. And you observe uvula elongated, bending towards the right side. This is what you observe. Uvula is there and bent to the right side. This is what you have watched. From allopathic point of view, whatever it may be, one antibiotic, one anti-inflammatory, one antacid, that's all. From your point of view, in complete repertory, there is a rubric called as throat elongated, uvula bent to the right, Barata cough, single remedy. I have treated many more cases with the Barata cough in this throat. Just observing the throat. Just observing. This is learning. This is what you have to learn. This is what is the learning process. I have watched, I have read, yes, this we can use. Then I have utilized. I got success. Then I have utilized many times if it is confirmatory. Okay? Is it clear? There is one more thing with which patient approaches towards you. Characteristic behavior. Chief complaint, patient comes, doctor, there is very severe sore throat. What happened? 2 days back I got running nose and then I started severe sore throat and you observe his throat that there are enlarged tonsils. It looks very simple. It is common. And we say this is common symptom, no remedy. But this sometimes it might not be a common. You go and open the repertory, complete repertory, one rubric, throat enlargement of tonsils of coryza after single remedy sabadilla. Single remedy sabadilla. So you get many more such things in your repertory. And this is only because you know the case taking and prior you know it is there in your repertory. That's why you look. If you don't know, you will not look. And for that purpose, it is necessary to read many things from your repertory. I have done, when I have done the post MD from London University, it was a HMD course, I have made a dissertation on this. Value of observational rubrics from Kent's repertory and the Berger-Honig's repertory. And I have collected whole rubrics from both the repertories, which are observable only, and importance of it in prescribing. That made me to go through each and every chapter, each and every rubric, and went through each and every rubric and find it out as very specific, which will be useful in our practice, day-to-day practice. Okay. Then we'll enter into the dynamic aspect, the spiritual or mental. This is we have to catch. Here the perceiving is more important. If you put a question, how is your nature? तुम्ही एक कॉमन प्रश्न विचार, तुमचा स्वभाव कसा? एकदम बंडल, खराब, नालायक. What patient will tell? एकदम छान. Who is going to tell you the real nature? No one will going to guide you towards the real nature. So, if you want to understand it, then you have to understand that human being, the way he behaves with you, the way he presents with you. So, you have to find it out, the way with which he has approached towards you. Then you can catch all those things. How he used to use his logic. What you finds it out with the help of his way of using the logic. So identity, here you have to utilize your logic to identify his identity. So you have to utilize your own logic, thinking process to catch how this fellow is. If you put a question, how is your nature, he says, mind, must shant. And there is a child with him and he will just, this is not, he is not mild. His behavior is not mild. Here you have to catch. And this happens many times. And that's why should not put a question. Whichever, go on perceiving the things. Perceive the human being in relation with all those things. Because there are many number of things. If you would have opened your eyes yesterday, you would have got many personalities. रिझल्ट लागला बघा लोकांचे बिहेवियर कसे कसे होते प्रत्येकाचे. युनिव्हर्स मध्ये काय घडलं तिकडे घडलं तरी इथं रिॲक्ट होत. बॉम्ब ब्लास्ट तिकडे झाला अमेरिकेत इतर लोकांनी रिॲक्ट केलं. बिकॉज ह्युमन is a person who reacts to everything whatever happens in the universe. स्कायला पडणार अशी एक बातमी आली त्याविषयी. लोक एवढे घाबरलेले होते ते घराच्या बाहेर जायला लागले. काय आपल्या डोक्यावर पडलं तर काय होईल. There are a number of things because these are things with which people react. So he reacts to the universe, he reacts to the planets. Planets म्हणजे ग्रह. Is there any impact of planets on? Sure. There are many people who never believe planets works on you. Those who are people from Andhashraddha Nirmala, they never believe on such things. If you observe just a maternity hospital, go to the maternity hospital and find it out a delivery cases. When it has happened, you will find that it has happened either at the full moon or new moon. Maximum cases, very occasionally in between. Why? Why it happens? There is the impact of moon, the gravitational force of a moon on that fetus which is there inside the womb. Why it affects that? It affects that because moon's gravitational force affects on the sea water, producing over there eggs and blood. This happens. समुद्राला भरती ओटी येते. कशाने येते म्हणतो आपण? It happens only because of moon's gravitational force. Same water is there around the fetus. Amniotic fluid contains similar salty water. It acts on that and it produces its effects over there, and that's why delivery cases happens to be there more commonly during full moon or new moon. It is simple example which directly expresses planets have the effect on the human mind. Those who are sensitive, they always gets affected from Saturn. There are many effects of it. Only thing is that we should know that. If you know that, then you will accept. If you don't know that, you will not accept. You have to read. Once you start reading homeopathy and you are learning the homeopathy, you have to learn all those dynamic things. Whatever happens in the nation, effect is there on you. बाबरी मस्जिद तिकडे पडली. दंगे कुठे झाले? भारत. Human reacts to anything which happens worldwide. Anything happens in state, you react. Anything happens in your district, you react. Anything happens in your city, you react. Anything happens in town, you react. Anything happens in your village, locality, you react. And whatever happens at your home, you react. The human reaction in response to all those things is the nature of human. And that's why this is one entity with which you ask. So you tell them certain things and then you catch. Is how will you what's the effect of election on you? What has happened? What is your reaction? And patient starts telling it. Then judge how this fellow thinks. Then you catch his nature. So this is very important. Two important notes where you can get human observation. Domestic means around in his house. What is his position? How he behaves with them? How many people are there? Their reactions with each other. Whether there is any impact of the quarrels between parents affecting the human being. child तुमच्याकडे आलं who started getting the schizophrenia. Child is in 7th standard and started getting schizophrenic features. I got that case. 7th standard. I got it, how this fellow is getting such types of features. He is becoming paranoid. Then I asked, what's the wrong with you? Asked him, what's the wrong with you? He said, there are many problems in our lives. So what is the problem? No, there are many quarrels going on with my parents. Then I asked him, I will not give you medicine, you send him your parents to me. Both of them professors. Both of them were professors. Professor rank, getting 1 lakh, 1.5 lakh salary per month. Both of them. And when first time his mother came, asked what's the wrong with your child. She said nothing. No, he is entering into such a dangerous disorder. And he is saying that there are problems, fight between you and your husband. Then she said, better you ask sir. I said, bring him. Then both of them came. I told him directly, your child is getting schizophrenic only because you are quarreling. Tell me what is wrong with you. And what's the problem? Because if you are making your intelligent child schizophrenic, you are responsible forever. What is wrong with you? Then they, whether to tell or not, then started. Doctor, there is a dispute going on between myself and my wife. And then they told whole story. Story is not belonging to them. Her sister's husband died because of HIV. And she was alone, she was quite poor. And this lady wants to give 500,000 rupees monthly to her as a just charity because, and quarrels is only on that point. Why do you give 1,000 rupees to her? And quarrel was continuous for 1 year. And they fought in front of me for 2 hours. I told them, I also started getting the schizophrenic state. Then they understood the thing. If you do this, your child will be schizophrenic. You are most responsible parents for them. They understood the thing. I told them how much you are earning, 3 lakh per month, both of them. Giving 1,000 rupees per month, what matters you? Is there any, if your problem is getting solved just giving 1,000 rupees, then why do you make a quarrel on this? Then they understood and solved the problem. This fellow was intelligent enough. Now he is working in Switzerland. That child is at a very high rank. So this is how you have to lead towards to solve the cases. Homeopathic remedy never works every time. You have to understand what is the dynamics. What are dynamics which plays a role behind the disorder. So that's why domestic relations and their effects. There is one ruling, discords between parents. Elements from discords from parents. I don't think this is there in Kant's repertory, it is in synthesis. Elements from discords between parents. Or discords between parents, elements from, like this rubric is there in synthesis. I don't think it is there in Kant. Open Kant, but I don't think. Discords म्हणजे काय? वादविवाद. Okay? Okay. Keep it in your mind. Let us see that. Last point is social. Human in relation with social. Society. Human is not the person who used to remain alone. He is the person who remains in society. But every individual behaves in a different manner in the society. Someone is leader. Someone is not getting mixed. Someone wants to remain alone. Someone never remains alone. He fears remaining alone. There are certain people, certain children, certain people who wants to remain in company any number of times. They goes to home late at night. So society plays very vital role in the understanding of human being. You have to ask that how are your social relations and what is your position in the social. Occupation. What happens? We used to do just ask what is your occupation. He says conductor. You immediately judge, are you getting varicose veins? Because it has been taught in our. This is not the homeopathic case taking. If you ask what is your occupation, then you have to put further. He says, I am doing job. What do? We write job. Make it black. Finish. What should be? You should ask. त्याच्या पुढचा प्रश्न काय विचारला? Are you happy with the job? Are you happy with the job? Then he says, Doctor, I never wanted to do job, but the condition was not there to do a business. Actually, I like business too much. But condition was not like that. Got the remedy, finished. Whole case taking is finished here. You got the remedy in just preliminary data after asking what is your occupation. Rubric is? Same rubric just now we have learned. Undertake things opposed to their intention. Intention was different, but taking the things in a wrong way because of the condition. Sepia was first finished. So occupation, you have to ask many questions. Are you happy? Are you satisfied? Whether you like to go to the occupation, everything is important. There are people, sir, I just like to do business and earn the money, finish, nothing more than that. Ambition increased money. There are certain people, there is one of my friends who wants to show himself every time, everywhere. Whether he get money or it doesn't matter. But he wants every time pay. Whatever he does, immediately post, immediately he makes a post, publish it, he makes the post with the people who are known and publish it on Facebook, on Insta, everywhere. Show off, but there is a rubric show off. Ambition increased fame for. There is a rubric, ambition increased fame for. Fame म्हणजे काय? प्रसिद्धी. So rubric, you get the lachesis over there. In first you get the lycopody. But there is one remedy only which covers both the rubrics. Which is there in fame for, which is also there for the money for. Is natsomika. It is natsomika which wants both of these. Last point which you have to judge is the susceptibility. Susceptibility means what is susceptibility? It is an inherent capacity of living things to react to an external stimuli. Anything, some action, reaction, that is the nature that indicates you are living. So, whenever exam is going on, there is action from the examiner and you don't react. It means you are non-living. Susceptibility is the condition which you have to judge. It depends upon many factors, it's a different seminar. Susceptibility and learning the susceptibility and judging the susceptibility is a big seminar. There are a number of things which you have to take into consideration, and this is one more seminar. You have to understand the Mayas and Cedars. These are two different Mayas. 4-hour seminar is there, complete Mayas total. We'll do that later on. Human health, there are two types of health. One is absolute, another is relative. Absolute means Gautam Buddha, miasmatic. They have not having any type of disease thought in their mind is miasmatic. But becoming Buddha is rather difficult for we are in relative state of health called as latent miasmatic. We have all miasms in us and that's why we react. So reactions always develop because of miasms. Dynamic and adynamic aspects of human being, and there are two varieties of cases with which patients presents to you. One acute and chronic. Acute are again divided into four types. First is indisposition. Second is sporadic. Third is epidemic, and fourth is endemic. What is individual? Individual reaction. Here it is the individual reaction. Susceptibility is very high, and because of which they react to some exciting stimulus. So all of you taken the tea, one of you got the acid reflux. All of you taken the same pav bhaji, one of them got gastroenteritis. Individualistic reaction. So here susceptibility plays a vital role. Second variety is also susceptibility plays a vital role. Sporadic diseases. Sporadic means what? Those which are caused because of environmental factors. Meteoric or meteoric experiences means environmental factors are called as sporadic disease. So change of weather, everyone never gets the coryza. Few of them you get the coryza. So again here the susceptibility plays vital role. Okay. But third is epidemic and endemic. These are the disorders which are not depend more on susceptibility, they depends upon acute miasm. This is the word used by Hahnemann in aphorism number 73, where he says these epidemic diseases and endemic diseases are caused because of acute miasm, for which it is nothing but the acute miasm is nothing but the parasites, nothing but the viruses, nothing but the bacteria, and it depends upon the virulence of that. So chikungunya epidemic was going on just now. Previously there was swine flu epidemic or even COVID epidemic. Here it was not more dependent on susceptibility, it was more dependent upon the capacity or virulence of that specific entity. So that was another thing. So last two things are dependent upon the virulence of the acute miasm. First two things upon the susceptibility. So your approach changes. When you deal with the cases, for first cases your approach is different, for another two cases, epidemic, endemic cases, your approach is rather different. And that you have to keep in your mind when you deal with the cases. So, acute miasm-jara cases, those cases depends upon virulence of the acute miasm. Last points of today's seminar is communication. Communication skill is a very important entity one has to develop. I was Barata in childhood. I was not able to talk with anyone. I was not able to discuss things with anyone. I was rather timid, shy. But I have changed a lot, complete from one end to another end. Now you tell me anytime to go on dais, I can do. But I have developed those. And there are a number of factors happened in my life which changed me from one end to another end. For being a homeopath or to develop yourself as a homeopath, you have to change. You have to develop. And how will you develop? You can develop this only through just keeping your eyes open, reading n number of things other than your subjects. Reading makes you a different personality. Meeting certain persons who have different ability, who have done in their life a lot of things. I met Vikas Amte, I have met with Baba Amte, I have met such wonderful persons. The impact of them is always there on my mind, which changed me a lot. There are many people who have made an impact, and because of which you get changed. If you want to develop the communication skill, read a lot, n number of things, go on reading and finding it out. How the people talk, how the people write, and that once you get over it, then you develop this communication skill. So communication skill is the basic criteria to do a good communication, and then one important thing which you have to develop and which is not there with all of you. What is that? This is the biggest entity which one must have. You should be a very good listener. Listener is very important. आपण ऐकून कमी घेतो, ज्ञान जास्त वाजवतो. And during case taking, what is needed is to listen. If you become a good listener, you will get many female patients in your OPD. Because no one listens them at home. You get ample cases because this is the one quality which gives you ample data and you get a real nature of human being if you are a good listener. You should not interrupt the patient. When patient started narrating, don't interrupt. Go on listening what patient is telling. Understand. These are very important things. That's why you have to develop this specific character. Then understanding the state of disposition. What is state of disposition? Understanding state of disposition. State is the entity with which patient approaches to you, presents to you. Symptom is very common. Symptom is not state when it wears the clothes of individuality, then it becomes a state. Patient comes to your OPD with a toothache. Oh doctor, please help me do something, I will die. You take fear death of 100 remedies. There is one sentence written in Economic, first remedy you read. Fear of death predicts the time of death. Patient will not come, doctor. I will die on this date and this time. Now he is telling you, I am dying just. He is predicting his time. This is prediction. This is aconite state. This is tossing in agony. This is called as tossing in agony. He is in absolute turmoil, aconite state. Whether he got heart attack, whether he got toothache, whether he got muscle pain, whether he got knee pain, whether he got abdominal pain, whatever it may be, this state is of aconite. Then you give the aconite. You have to give the remedy to the patient not for his symptom, not for his toothache. You have to give the remedy person suffering from toothache, and here you get the remedy. So even heart attack you can treat with the aconite because his state is aconite. So this is what the state of disposition is there. State of disposition is the man behind the symptoms. That's what you have to catch. So everywhere he has mentioned about, for example, 88, Hahnemann says state of disposition of mind is, or mind is very important. Then for example 208, again he says state of his disposition and mind must be attended to. Then he says in 211, this holds good to such an extent that state of his disposition of the patient often chiefly determines the remedy. So this is what you have to look for. The way patient presents is his state of disposition. Patient comes and tells me, doctor, I'm suffering from such a disorder since long time. I have gone to many doctors, but I never got the result. Someone told your name, that's why I am here. So this is my problem. How much time does it will take to recover? You see his case, his reports, you tell at least you have to take 6 months to 1 year treatment. Okay, doctor, I agree. You take 2 years, it will be okay for me. But plus please cure me. Finished. This is the state. This is which he has approached. His problem is rheumatism, his problem is whatever it may be cancer, it may be tumor, whatever it may be. He talks in this way. This is his state of disposition. What he has said? He said, you cure me. Whatever time you will require, you take your own time. It doesn't matter for me. The way he expressed is mildly, in a pleading mood, and he expects you cure me. Carried desire to be carried slowly is pulsating. Is pulsating. A single remedy is pulsating. So this is what is the state of disposition. So state of disposition, manaचा कल, स्वभाव, प्रवृत्ती, मनोरचना. Everyone is having a different manner. Everyone presents to you in a different manner, and this is what you have to catch during case study. Is it okay? How do patient looks towards his disease and what he feels? That is another important thing which you have to think. That is what is that gives you idea regarding the patient's state of disposition. This is what is the patient's state of disposition. If you ask, what do you feel regarding your disease? Finish. This is the patient of cancer comes to you. Patient knows it. Patient is having cancer. She is having cancer. You just ask, काय वाटतं तुम्हाला आजार आहे? Finish. You put it in a right way. You put just simple question. तुम्हाला आजाराकडे बघून काय वाटतं तुम्हाला? And then patient all of a sudden starts weeping. All of a sudden starts behaving in abrupt manner. All of a sudden shows certain things. Real nature of the patient comes out. The state of disposition is reflected in this. This is very important. So these are the things which one has to understand, and you have to ask the patient what he feels, what she feels. Feeling is very important. Feeling gives you patient's own nature. It reflects you patient's own nature. Sensations, very important because they are individualistic. Sensations are always individualistic. Someone says, you ask, डोकं दुखतं, कसं दुखतं? You ask how it is. Someone says throbbing, someone says neuralgic, someone says cramping, someone says heaviness. Everyone will going to tell you every different sensation because that is individualistic. That's why feelings makes the difference, and that's why you have to ask it specifically. So state of disposition is one important thing. Now we will turn towards again state of disposition cases. Two cases are there. Very simple. Just read. What is there? In my homeopathic workshop, it was a case in 2008. One student came from very long distance for learning homeopathy. There were 5 students, 4 of them female, 1 male. They came right from Gading. And they asked me on day 1, sir, after 5 days, if we stay over here 1 or 2 days and attend your OPD, is it possible? I said, oh, yes, why not? I have given permission then on day 1 only. And then, after finishing 5 days workshop, last 6th day, they were sitting in my OPD. And the OPD was going on, running. And there were many patients, and right from 8 o'clock in the morning till 1 o'clock, continuously they were seeing the patients' cases, and I was explaining them the remedies and all those things, and this was going on. And everything, and I was explaining them each and every reasoning, all things were going on. And just after finishing the OPD at 1 o'clock, then they went to their rooms, the upper, this floor, they went into their room. I was there in my house. And for some reason, there were some students from Ahmednagar also came from workshop. They were residing in same group. So they were residing in them. I was having some work with them, and then all of a sudden, I got a noise. One of the students was crying. Out of them four, one was crying loudly. I could not understand within 5 minutes what has happened. Just they came right from there to this room, and within 5 minutes she was crying very loudly. So I asked, what has happened? So the answer was very good. She said, Doctor, sir, she was having very severe colic. She was having very severe pain in abdomen since morning. Then I asked, why you have not told me you are having the severe colic? Why you have not said like that? 4 hours you are sitting. What she said? Sir, actually you are teaching so nicely at that time. I feel how I can say such a thing. This is the case. Finished. What remedy you will find? That's all. This is the case.
Not complaining.
Huh?
Not complaining, sir.
Not complaining. Okay. Anything else? This is the state of disposition. So what is the state of disposition? If you catch whole situation, you get the remedy and you get that specific state in that rubric. Very specific. Actually, what is there is it is her duty to tell me, sir, I am having severe pain in abdomen, can you give medicine? It is her business to give me, tell me, yes doctor, sir, I am having problem. She has not uttered a single word. Why? There was a timidity. She was timid. So at that time it was her business to tell me from whatever she was suffering, so that I could have prescribed some medicine to her. But due to her timid nature, she never expressed the feeling. Rooted is timidity, business in transacting. Transacting means to express. Single remedy opium. I said I will give medicine, within 5 minutes you will get pain relief. But what she said, sir, I cannot take your medicine. What? My treatment is going on for PCOD, and doctor have given me stramonium, and they said don't take any medicine. So I asked which treatment is going on, and she said one of the name who was my student. So that's all, only this thing. I called immediately this. I said, Pritam, his name was Pritam. This is the patient. She is there with me, and you send them for some workshop, and she is having such thing, and I am quite sure she is opium. Can I give? She said, sir, तुम्ही का विचारता? Why do you ask me give? No, she is refusing to take remedy unless you say. He said, I have given stramonium, but it is not working. She was not getting periods from 45 days, or it was more than that. Asked her, then he said, give the opium. I have given opium 30. Within 5 minutes, her pain in abdomen stopped. I told her that within 2 days you will get the periods. And next day they went, and in the evening she called me, and she said, yes sir, I got the periods. So this is what is finding it out, specifically the state of disposition. If you catch it and it relates to the whole case, then it definitely works. So rubric was immediately transacting her business well, opium. Now another acute case, recent case. Recent means it has also happened 3-4 years back. 22 She was my regular patient since long time. She had growth inside the mouth, It is an exostosis, bony growth inside the mouth. It was there since last 15-20 years. But all of a sudden she had some pain in teeth, and it was seen by dentist, and he just looked, what is this? And his face frightened her. He has taken X-ray, everything, and nothing found abnormal. Still, the thought was there, डॉक्टरांनी असं का पाहिलं? Doctor, is it cancer? And she came with parent, everyone, husband, and she was weeping in front of me. And she had a problem because she had lost 6 kg weight within last 2 months. And she had a problem. So she felt it might be related with the cancer. So I am getting loss of weight. So that she asked that dentist, my weight, there is weight reduction, 6 kg I have lost. I was 66, now I am 60 only within 2 months, and I have not done diet, anything, and it has suddenly changed. He said, you have to investigate. And once he said like that, she was disturbed, and she came to me daily. So she was weeping, she was frightened, and she was frightened because of cancer, that's all. So state of disposition you have to catch. Asked her to go for thyroid, and her thyroid TSH was too down. It was a case of hyperthyroidism, because of which she has lost the weight. I told her, I'm damn sure you might have, because her pulse rate was quite high. See, 110 it was there. So loss of weight, sudden loss of weight with high pulse rate, with sometimes trembling, it is always a hyperthyroidism. So I was damn sure about it. It was confirmed, and then they asked them next day, and she was there in front of me. So that state itself reflected one remedy. If you catch that rubric was very interesting. Fear cancer of weeping weight. Only remedy given was agaricus. It was agaricus. See how important it is to reach to the right state of disposition, because that agaricus solved whole case. Till today she has not given any anti-thyroid remedies. 22 to 24, nothing was given. Her all reports are normal. She gained the weight again only with agaricus 33 doses. 3 doses of agaricus, and immediately the pulse found to be a normal. Her pulse rate, which was tachycardia 110, it reached to 70, and now she is having that exostosis over there. It is congenital, it is persistent, it is not cancer, and she agreed this is not a cancer. She came out of that delusion because of the thing. So communication, there are 2 important things, verbal and non-verbal. Non-verbal you used to use, verbal also you used to use, and those are most important weapons in order to get a very specific thing. Most important thing, what is needed to make a good combination is the big smile. How do you look towards the patient? Patient ने तिकडून काय patient गेला तिथंच. Your behavior matters a lot, and that opens the forum for communication is the big smile on your face. Your approach should be very nice, and that's why you should develop those. These are the personality skills which one has to develop. You should get communicated with the people, and smile is one important entity which opens up the channels. And that's why it has been written, smile a while, and while you smile, another smile, and life is worthwhile. Because you smile, keep smiling. So that's the importance of a big smile. How will you start your acute case? Simple. एखादी acute patient आला, how will you start your case? There is no fixed rigid idea. Anything gives you the case. This case was very important. There are different ways of understanding things. and many aspects to understand this. One of this case was mobile case. I have done seminar on Dr. Gauram's platform. She was the Payal Sanadhya from Delhi UP side, and she called me. She just sent me a message, and this whole communication I have mentioned over there. This is the whole communication as it is. Payal. Good evening, sir. I am Payal from Advanced Course. I need your help in one infant pneumonia case. She has been admitted from last 1 month. It would be great if anything we can do. Something. Can you share the details? Yes, sir. After 3 hours of birth, she got frothy discharge from mouth and having difficulty in breathing and with some kind of sounds. The chest depression was there since birth. Doctors took her on ventilator as her SpO2 was 60 to 65, and she was on ventilator for 1 month, continuous. When she called, she was on ventilator. Unfortunately, that video is not running in this. I can show it in my clinic. The videos are there. Here, the only picture is there. I will show you the picture on ventilator. But actual video is very interesting because you can catch remedy over there. I will show you that later. So doctor took her on ventilator as her SpO2 was 60 to 65. She was having much expectoration, sometimes with bleeding also. The color was normal, not dark. After that she got convulsions also. She had some kind of rash on chest. Now she is on CPAP machine and her SpO2 remains between 89 to 90 on CPAP machine. Doctor gave her blood transfusion in between. She had aspirated dirty water during delivery. After that, all this happened. My drug of choice is Ipecac, but afraid to give, so I consulted him. This is the use of importance of mobile phone, WhatsApp. And she called. So I made her call, and I said, no, it's not Ipecac, Payal. She sent me a video. This is the actually, unfortunately, it is not running over here because it's Windows is XP, it is not running. But you can listen the sound. He was on BiPAP, Chehra Suzilal List. That video is there, and SpO2 was 89 to 90. And I said it is not Ipecac, it is anti-inflammatory. And I have told her give anti-inflammatory. This was the case. And I have given anti-inflammatory. Anti-inflammatory you read it better from the Borix Materadica. Then you will get this whole case belongs to anti-inflammatory. Mechanical as apparent death from drowning, from mucus in bronchi, from impending paralysis of lungs, from foreign bodies in larynx and trachea, with drowsiness and coma, great sleepiness and irresistible desire, inclination to sleep with nearly all complaints, asphyxia neonatal child, at birth pale, breathless, gasping, release dead rattle. So it is anti-inflammatory. I said it is not Ipecac. There is a difference between Ipecac and anti-inflammatory. Anti-inflammatory also acts through the pneumogastric nerve, but it depresses the pneumogastric nerve. And because of depression of pneumogastric nerve, the respiration becomes slow, dull, sluggish, and then because of which the exhalation, the amount of moisture which should be thrown away never gets thrown away. It settles over there, rattles over there, and make a rattling on third day, fourth day. Is the anti-inflammatory rattling? Anti-inflammatory rattling असं तयार होतं. This is Dr. Rasal's thought. It is not given anywhere. But Ipecac is the remedy. See, it also acts for the pneumogastric nerve, but it stimulates the pneumogastric nerve. It irritates the pneumogastric nerve. So yesterday nothing was there. Child wakes up and all of a sudden full of congestion, rattling is there within a day. Anti-inflammatory rattling, it develops long period to develop 4-5 days. It is infective focus, makes the tongue thick, white coated. Ipecac, it develops within a day, no infective focus, tongue is clean. See the difference? Then you can catch, understand the remedy. I said it is not ipecac. Ipecac, it might be day one, it might be. Today it is not ipecac, it is antimpta. One more remedy is Lobelia implata, which you can use. That is also one remedy, Indian tobacco. Having action on homeopathic nerve. But here, my choice of remedy was very clearly antimpta. 10th April 2022, antimpta 30 TDS for 1 week. Why 30 repetition we will discuss later, because it's not time. There is no time to discuss. This child. Actually, video is wonderful. That is smiling child. Absolutely smiling. That was wonderful to see. Completely out of bypass, everything, and child was absolutely smiling. And you confirm the remedy, nostrils are dilated. That is antimpta. Nostrils are dilated. That is antimpta. So you get the remedy anywhere in acute if you catch. And there is no need that every time you should go over and find it out, the remedy over there. Okay? This is one more understanding. And what is important is acute brief history. Acute case taking pro forma I will not going to teach you because this everyone knows. This topic we will discuss one more time because it is a big topic. Every patient's name, why it is important, date of birth, why it is important. Every point has its significance. But it takes one more second. I know human capacity is not more than 3 hours to sit over there. So these things, again we'll do a seminar on same topic and we'll complete those things. I will discuss each and every point of it in detail and its importance in homeopathic prescribing. So acute case taking, location, sensation, pathology, modalities, concomitants, this is the only thing with which you get the remedy. Acute मध्ये एवढंच महत्त्वाचं आहे त्याच्यावर तुम्हाला रेमेडी मिळणार. Chronic it is not so. Acute, these are concomitants which you have to catch along with main symptom. What is there along with this? This is sufficient for present mental state which you can catch in acute. And then you have to go for acute totality, acute remedy, homeopathic management. It is not our topic of today. Chronic case, definitely it is different. Chronic case, how will you start chronic case? If it has been asked, I ask the patient to come tomorrow morning, my assistant will take your case. How will you start? If you are my assistant. काय म्हणतात? काय होतंय?
कधीपासून होतंय?
कधीपासून होतंय? अजून अरे तुम्ही पहिल्यांदा भेटताय, you are not meeting that fellow. How will you start communicating? Smile. Very good. काहीतरी शिकले आहे. अजून ग्रीटिंग हिम. Yes, greeting, नमस्कार. असं ते पण आतून आलेला पाहिजे. सरांनी पण नमस्कार. No, not having significance. It should come right from your bottom of heart. That should be there. That is unique. That makes the difference in communication. Then, in तुमचं नाव काय? No mechanical mistake. You start. For what purpose you are here? From where you are? How do you come over here? Patient talks different way. Doctor, they तुमच्याकडे येतात ना, त्यांना फरक पडला. मला वाटलं मलाही पडेल म्हणून मी आलो. Say simple sentence, but that gives something. What he said? तुमच्याकडे ते येतात ना, त्यांना फरक पडला. मला वाटलं मलाही पडेल. काय? रुब्रिक काय? लाईट कशा? त्यांना फरक पडला, मलाही पडेल. सुपरस्टिशियस. दिस इज सुपरस्टिशियस. दुसरा आला तो म्हणतो नाही डॉक्टर ते होतं तुमच्याकडे, ते म्हणे जा बघू म्हणून मी आलो. ते म्हटले म्हणून मी आलो. मी काही विचार केला नाही तुमच्याकडे, मी फक्त त्यांना विचारलं का कोण डॉक्टर, ते म्हटले जा तुमच्याकडे. आलो. आपण अशा माणसाला काय म्हणतो? व्हॉट वी से? भोळा. हिंदीत भोळा, इंग्लिश मध्ये BHOLA. इंग्लिश मध्ये काय? रुब्रिक्स कळले पाहिजे. क्रेड्युलस, क्रेड्युलस, क्रेड्युलस किंवा कॉन्फायडिंग असा त्याला क्रॉस रेफरन्स आहे. पण तुमच्या केंट मध्ये पण असेल बघा, क्रेड्युलस किंवा कॉन्फायडिंग. आहे का बघा? CONFIDING, कॉन्फायडिंग FIDING आहे ना. Confiding, credulous, भोळा. There are two words. One is naive, NAIVE, naive. असा पण एक रुब्रिक आहे का बघा? NAIVE, naive. Is it there? naive? केट मध्ये नाही का? नायूचा अर्थ आहे नौका. नौका, नौका म्हणजे who is new over there. There is a difference between credulous and naive. Credulous doesn't have his own sense. Naive, because he is new in that place, he behaves like credulous, but he is not credulous. Because he is not knowing what is happening over here, that's why he looks like to be a credulous. But once he is there, understand things, he never remains credulous. That is the difference between naive and credulous. So you have to catch those differences. These are very minute differences which one has to understand. So you can get just put a question and you get answer and you start getting the case. This is how you have to enter into the case. So this we will discuss later, chronic case taking, pro forma and chronic. This paper I will discuss one day, whole paper. My test paper is there. This is what there I have put over there. That we will discuss in later seminar. But before concluding, this whole case taking format is there. And that we will do for the next seminar, and every word from that I will going to discuss. So the mental state, the psychodynamic, the psychosomatic, and all those things, life stress investigations, what they are, dispositions and expressions, everything I am going to tell with physical general examination, but it will require 3 hours. It is again a 3 hours period which will require. Everything after that, investigations, the importance of investigations in homeopathic prescribing, provisional diagnosis, clinical diagnosis, then repertory totality, and then result of preparation. This is the whole process. That process will take it as a separate seminar or next seminar. And then how to manage. This is written on my paper, last page. This is what written. Homeopathic management, auxiliary measures and medicine. The importance of auxiliary measures in homeopathic management is very, very, very important. That so we have to understand all those things over there. To conclude seminar, simple case, very important case. You will learn a lot and then we will finish. Are you bored? No? Are you hungry? Yes. So after finishing the seminar, you go to your room. A 60-year-old male, short-statured, emaciated from Delhi, a diagnosed case of chronic lymphoid leukemia, since last 10 years came to me with multiple indurated glands on neck. इथं सगळं ग्लँड्स होते, एवढे मान दिसतच नव्हते, एवढे मोठाले ग्लँड्स, बिग ग्लँड. With recent leukocytic count was 52,000 per cubic millimeter. Is very casual even after knowing his disease. He has not done any treatment due to his cowardice nature. केमो सांगितली होती, हिंमतच नव्हती त्याची घ्यायची. 10 वर्ष आला सांभाळ. He was not able to take decisions. He was brought by his elder brother for treatment. Thermally, he was very hot, never requiring covering, used to bath with cold water regularly, always wants spanning. That's the case. Whole case I have taken, but this is the glimpse. काय remedies? What should be your approach to deal with this patient or must the acute disease to chronic? Chronic CLL, chronic lymphoid. Your approach, miasm. When so much of glandular enlargements are there, the miasm is always reversed. Okay. Now what is the remedy? Open your book. Simple remedy, 4 lines, but remedy is wonderful to cure this patient. This is the repertory I have done. Cavernous, Riolus, dwarfish, resolution, immunization of old people. Barataka, Lycopodium, iodum. But I have not given Barataka. I have given a synthetic prescription. Barataka with iodum is Barata iodide. So, repertory is a tool to reach towards minimum but not an end. Final court is always the materia medica. So we have to go to the materia medica and Barata iodide. Open the Barata iodide. 4 lines are there. Acts on lymphatic system, increased leukocytosis, quincy, indurated glands, especially tonsils and breast, tumors ophthalmia, with demutation of cervical glands and stunted growth, tumors. Finished. That's all. That's the remedy. So Barata was fixing very clear. I have given him Barata iodide, started with LM1. Within 1.5 years, I have reached to Barata LM50. Every monthly changing, and he got complete recovery from that. So, wonderful case of chronic lymphoid leukemia covered with Barata iodide. Because got the remedy perfect. So in short, case taking and perceiving is nothing but the endless study of understanding human being with open minds and senses of the homeopathic patient through his communication skill. We have to go ahead in learning homeopathy like this, and I expect that you must learn in this way. In short, what we learned today? We have learned many facets of test taking, but not complete, because it is an endless study. We have gathered certain things, we have gathered certain rubrics, we have read certain remedies. These are things with which we learn. My suggestion to all of you is that this is a seminar where it is a passive communication. What I used to tell you was to observe, you have to learn. You must take part in active learning. Active learning is more important because there you can learn a posology aspect. There you learn exactly the process, how I used to talk with the patient, what I used to do with the patient, how I examine the patient. I used to explain the examination process and importance of it in homeopathic practice. If you do that, that makes a difference. My suggestion is that don't go for passive learning, learn actively. If you want to join our OPD, there is only one criteria. You have to purchase the books of 7,000. But those books are not curriculum books. Those are books with which you learn homeopathy. But that's one-time investment for you to learn something where you get many books which are practical oriented. And once you become member of us, you don't have to pay anything forever. You become member of Sai Swami Homeopathic Clinic forever, and then you will be forever for us. Then you come anytime in your lifetime, you will get a chance over here always. So my suggestion is you must always learn like that. And what I am doing is nothing but the task explained by Swami Vivekananda. He says that if a man goes towards what is false, it is because he cannot get what is true. This is the problem with homeopathic students. Therefore, the only method of correcting what is false is by supplying him what is true. Do this and let him compare. You give him the truth step by step, and their work is done. And this is what I am following in my life. So thank you being there, listening to me exactly 3 hours. So 3 hours have been passed. My suggestion, those who are really interested in homeopathy, do subscribe our channel. It doesn't carry any money. Subscribe the Divine School of Homeopathy on YouTube. Nearly about 50 videos are there already uploaded from Repertory, from Organon, from Medica, from General. You can listen them anytime. You can get a lot of knowledge. And those who want to become a member of Divine School of Homeopathy, be a member by paying once 500 rupees and be a member of Divine School of Homeopathy on my mobile number. That either GPay, PhonePe 9890168872. But if you want to join our OPD, the 7,000 are there. You don't have to pay 500 more extra. That includes over there in that. So you become directly a member of Divine School once you join our OPD. So that's all for today. Thank you being there, and I expect similar type of response from all of you. Second important thing, there are many new faces. I want to meet all of you after the seminar, make so that in future we'll have good communication. So I meet me and then go away. Third thing, one of my student, he wants to share his thoughts with you. He will take only 5 minutes of you, even though you are hungry. But he expects that at least he should get 5 minutes. It is too important, because listening and someone feels from bottom of heart that yes, I want to say something, it is always a time to give him a chance. So he said to me, be here, Sanket, take that mic, and yes.
गुड आफ्टरनून. तुमच्यासारखाच मागच्या सेमिनारला मी आलो होतो आणि दोन गोष्टी मी सरांमध्ये ऑब्झर्व केल्या की ही रॅडिएट्स नॉलेज अँड ही रॅडिएट्स द प्युरिटी ऑफ लाईफ, जे तुम्ही आज केलेच असते. आणि त्यानंतर मी सरांचं लिंक जॉईन केलं आणि दॅट इज द टर्निंग पॉईंट ऑफ माय लाईफ. ते केल्यानंतर मी बऱ्याच गोष्टी सरांकडनं शिकलो. तर त्यातल्या काही गोष्टी मी तुम्हाला शेअर करू इच्छितो. त्यामध्ये रीड वाईडली विथ मॅक्झिमम क्युरियोसिटी. दॅट इज वाय यू आर हिअर today. You are here to read more because you are curious, but don't let it stop here. We have to take homeopathy further. It is our mission to grow homeopathy. जसं आज करताय की सेमिनार घेऊन तुम्हाला सगळ्यांना मोटिवेट करण्यासाठी, होमिओपॅथीची ग्रोथ करण्यासाठी. सेकंड थिंग इज दॅट ऑलवेज पुट रियालिटी फर्स्ट अँड थेरी लास्ट. की जे होमिओपॅथीचे मिथ आपण बघतोय की होमिओपॅथी स्लो आहे, जी होमिओपॅथी क्रोनिक डिसीजवर व्यवस्था करणे, स्टेरॉइड आहे, हे सगळे मिथ आहेत जे आज ओव्हरऑल बघतोय पेशंटमध्ये. ते आपण कुठं ना कुठं मिथ घालवण्याचा ट्राय केलं पाहिजे. आणि होमिओपॅथी इज नॉट सुपरफिशियल, नॉट सेपरेटिव्ह. It's only science that offers genital, permanent and rapid cure in the patients. And third thing is that we have to leave money and status from that. It is to be most versatile in homeopathy. From smallest to biggest problem, you should be able to address everything equally effectively. If we choose the result, the cause does not become correct. If we focus on the cause, the result becomes correct. So, fourth point is that manage your identity. हा पॉइंट बऱ्याच लोकांना भाग पडणार नाही, पण तरी पण मॅनेज युअर आयडेंटिटी. की आपण दोन आपल्याकडं चान्सेस किंवा दोन अपॉर्च्युनिटी आहे, दोन्ही अट्रॅक्टिव्ह आहे, ॲलोपॅथी होमिओपॅथी. तर आपण त्या कॉन्फ्लिक्ट मध्ये फसलोय आज की हे करावं की ते करावं, ते करावं की हे करावं. पण आपण त्यातला एक कोणता पण याच्यावरती फोकस करून त्यामध्ये एक्सलन्स दिला पाहिजे. थर्ड पॉइंट इज दॅट यू हॅव स्किन इन द गेम्स. मीन्स इफ यू टेक टर्न फ्रॉम समथिंग, यू मस्ट गिव्ह बॅक समथिंग. जर तुम्ही बीएचएमएस स्टुडंट आहात, तुम्ही होमिओपॅथी शिकताय, तर तुम्ही होमिओपॅथीला काहीतरी देणं तुमचं लागतं आणि तुम्ही ते दिलं पाहिजे. Henman sir, we are the homeopath of Borik sir, we are the homeopath of Kent sir, we are the homeopath of Bogar sir. पण मी आज असं म्हणेल का we are the homeopath of Rasal sir. एक 3 Idiots सगळ्यांनी बघितलं असेल, 3 Idiots मूवी सगळ्यांनी बघितला असेल. त्याचे दोन कॅरेक्टर म्हणजे फरहान आणि रॅन्चो, जो आमिर खान आहे तो. तर त्यांची एक स्टोरी अशी की ज्यावेळेस फरहानला फोटोग्राफीसाठी, वाईल्ड फोटोग्राफीसाठी लेटर येतं आणि लेटर आल्यानंतर की ते लेटर आल्यानंतर तो कन्फ्यूज असतो की त्याच्या घरचा प्रश्न असतो की तो म्हणतो की अबू नहीं मानेंगे, मेरे अबू नहीं मानेंगे, उनको करना है इंजीनियरिंग. और मुझे करना है फोटोग्राफी, अब वो नाही मानेंगे. तर त्यावेळेस रॅन्चो त्याला असं म्हणतो की तू तुझ्या अब्बू को कन्विंस कर आणि उनको प्यार से समझा. आज डर मत फराना, नहीं तो 50 साल बाद किसी हॉस्पिटल में पड़ा होगा. लेटर हाथ में था, टैक्सी गेट पर थी, पर हिम्मत नहीं थी. हिम्मत कर देता तो जिंदगी का मोड कुछ अलग होता. 50 साल बाद ये तू सोचेगा. जर तुम्ही आज होमिओपॅथी करण्याची हिम्मत केली तर तुम्हाला कदाचित रिग्रेट होणार नाही की तुम्ही ती गोष्ट करू शकले नाही. ज्याला वाटतं की होमिओपॅथी करावी त्याने हिम्मत करा, आणि हिम्मत इज इम्पॉर्टंट इन होमिओपॅथी. की होमिओपॅथी करायची असेल तर मी एक गोष्ट शिकलोय की तुम्हाला पॅरासाइट व्हावं लागतं. तुम्हाला तुमचा होस्ट बघून त्याला चिटकून त्याच्याकडनं होमिओपॅथी ऍब्सॉर्ब करा. तर मला माझा होस्ट सापडलाय, तुम्ही तुमचा होस्ट करा आणि होमिओपॅथी ऍब्सॉर्ब करून घ्या.
थँक्यू. मला माहित नव्हतं तू एवढं बोलणार आहे म्हणून. थँक्यू, व्हेरी नाईस. सो this is the thing. This comes automatically from him. This is a very important generous thing. My suggestion कि आजही परिस्थिती, I have practiced more than 35 years. I got everything, whatever I want, I have achieved. Anything, money is not the matter. Maximum OPD per day I have earned is 1,97,000 per day. That much I have earned. That capacity is there with me, and in recent future target is more than 2. That I am going to get. But what homeopathy is there at present? State of homeopathy, if you go and the society, it is different. Still people doesn't know what homeopathy is. If you talk to them regarding homeopathy, what they answer? They sabudanyacha bolan. That's all. That is the identity. If you want to remove that identity, it means people are not knowing the homeopathy properly. They are on one side of ocean where they are ignorant about homeopathy. You are on another side of ocean, you know the homeopathy. But unless and until all of you know the homeopathy, you cannot pass that ocean. You cannot make a bridge to pass over them and spread the knowledge of homeopathy to them. This is my duty, this is what I think, and that's why I used to conduct such an activity. There is no question of earning the money, not at all. Actually what has happened, earlier we used to do keep 150 rupees fees, but at that time we used to give the lunch along with that we used to give the tea and biscuits, etc. But people say that you are earning the money through that. So I am not at all interested in that, and that's why I have stopped all those things. It is better to go anywhere and you take the lunch. But there is no question of giving or earning the money. So it is a activity which is not at all related with money. It is related with the propagation of homeopathy. And if you want to propagate, I alone cannot do. I want your help. So to conclude my seminar, I will say, सारे मिळून चालूया, सारे मिळून गाऊया. सेतू बांधारे सागरी, सेतू बांधारे सागरी. Thank you. So मित्रांनो